All right, welcome to Three Plastic Surgeons and a Microphone. This is episode number 7. Good morning, gentlemen. This is Dr. Salvatore Pacella out of La Jolla, California. His Instagram handle is at San Diego Plastic Surgeon. And Dr. Sam Jejurikar, Dr. J, out of Dallas, Texas. His IG handle is Sam Jejurikar. And I am Dr. Sam Rhee out of Paramus, New Jersey, and my Instagram handle is Bergen Cosmetic. So welcome today, gentlemen. How are you?
Great. How are you?
Good.
Doing great. All right. So as always, our intro. This show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based on circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care. And never disregard professional medical advice or delay seeking advice because of something in this show. And with that, we're going to get right into it. I know we're going to be talking today about cosmetic surgery of the face, and Dr. Pacella has a lot in store for us in that regard. We're also going to take a look at a couple well-known photographs of some celebrities who have had some aesthetic work done for their face. But the first topic today, which I'm going to bring up here, is something that I think we should talk about as well, and I know Sal feels very strongly about it too. And this was an article that was originally published a couple days ago and then withdrawn. It's called Prevalence of Unprofessional Social Media Content Among Young Vascular Surgeons, and it spawned a large hashtag. Let's go ahead and read down, and then we can describe it a little bit. So basically, it examined publicly socially available media content, and they felt that such media content could affect patient choice of physician, hospital, or medical facility, and they thought that their goal was to evaluate the extent of unprofessional social media content among recent vascular surgery fellows and residents. And this was out of Boston University in Massachusetts. They basically found, they looked at 480 vascular surgeons. 61 or 26% of the accounts that they found had what they labeled clearly unprofessional or potentially unprofessional content. 8 accounts had clearly unprofessional, such as obvious alcohol intoxication, uncensored profanity, offensive comments about work, patients, or colleagues. Potentially unprofessional content included consuming alcohol, controversial political comments, inappropriate or offensive attire, censored profanity, and controversial social topics. And I think one of the things that was mentioned was unprofessional content included bikini wearing or swimwear by some of the women vascular surgeons that they identified. Thoughts, Sal and Sam?
Yeah. So first off, let me say, I understand what the authors were trying to do here. The whole idea is to preserve the patient-doctor relationship as being professional, but it completely backfired. And there's one specific issue that came out here, and which is the wearing of unprofessional attire. And unfortunately, what they did was they focused on female surgeons wearing bikinis or wearing provocative outfits, etc. And this just comes off as a completely misogynistic article condemning women, and I certainly don't agree with it. I think it's terrible, and I don't really understand how the Journal of Vascular Surgery was able to publish this. People really need to understand that this isn't just something that was posted willy-nilly. When you apply for an acceptance of an article of academic quality to a major journal, it undergoes a significant peer review process. So several other authors had to look at this article and go through it. And so the fact, not only did these authors write this article, but the article was approved by at least 3 separate authors. So that just goes to show you the blinders on here. And, this article would have had much more validity if they just pulled out the images of bikinis and not use that as a criteria. So two other things to say here. I think this is, well, let me reach out to Texas Sam and see his thoughts here.
Well, I think I pretty much agree with all that you've said, and I think there's some broader issues. I didn't really hear about this article until I saw all the social media postings over the last couple of days from very intelligent surgeons and anesthesia providers with whom I work, where they sort of talk about the body shaming that's been happening with this and this hashtag med bikini that Dr. Rhee was talking about. And I think I'm encouraged by the outrage that this article has spawned and by the quick decision to withdraw it. I think it is demonstrative of the bias that we've had in surgery for decades, centuries, where there's been an element of misogyny. For years, surgery was a male-dominated profession, regardless of what specialty you're looking at. And with it, there has been some inherent gender bias and misogyny that's gone along with it. And as the world is changing and as surgery is changing, that mentality needs to change, particularly given our field, which is one geared towards aesthetics. There should be no room whatsoever for body shaming people for being attractive. You can be an attractive human being and you can be an incredibly intelligent person. The world is changing. Surgery is changing. This is a ridiculous context for an article. It sort of shows that in academic medicine, sometimes you just need to print articles, and the things that they think about sometimes really bear no resemblance whatsoever to moving the specialty forward. So I would agree with everything Dr. Pacella has said.
I think one of the things that was especially outrageous is that they considered bikini and provocative Halloween costumes to be unprofessional when they were basically targeting young women surgeons on how they dress during non-work time. That's sort of
Right.
ridiculous. To make those judgments about how we as surgeons dress outside of work is, as Texas Sam said, profoundly misogynistic, and I think basically reflects an older, outdated, prejudicial culture that we've seen in surgery and is no longer has never been acceptable, but is certainly not acceptable in 2020.
Right. It's interesting. Like what's completely jaw-dropping to me is how they went about this study. So these authors actually ghosted several social media accounts to be accepted by other social media accounts in order to do the research. And it's just overall very creepy, how they went about doing this study. Just absolutely crazy. On the same token, I think as physicians, we do have to present an aura of professionalism. Okay. And certainly I agree with making, with limiting your political comments, or coming down on people who make racist or offensive comments. I think that certainly has criteria for a study like this, but the pictures and the bikini shots, it's just so ridiculous. Why, how does that affect your ability to care for patients? It does not.
So just to be clear, are you saying it's unprofessional for surgeons to talk about their political views?
I think when it becomes offensive to other people, I think we have to have a common ground of respecting others' opinions. So when you do this in such a way that you sound misogynistic, racist, bigoted, that has no place in medicine and in professionalism, just like in any field.
So I know a lot of surgeons are now.
You don't want to be a Dr. Kevin or a Dr. Karen, if you know what I mean.
Dr. Karen.
I'm not going to jump on that bandwagon. My wife, whose name is Karen, but she is not a Karen, has literally been living a miserable life for the past 2 or 3 months. And so I'm going to leave that one alone.
I know that a lot of surgeons are now posting themselves in pictures with bikinis on. So I fully expect both you, Sal, and you, Sam, being in hot states to go ahead and join the trend and post selfies with bikinis on.
Well, I don't believe in body shaming others, but I do believe in body shaming myself. So that's probably not going to show up. I think, yeah, but I think it, just to sort of close this topic off, it's been incredibly encouraging to see so many surgeons and anesthesia providers and physicians of all specialties sort of rising up against this. I think the world really is changing for the better.
Yeah, there is a, as you said earlier, there's a tremendous gender bias in surgery. It's a male dominated field, and there are amazing and talented professional female surgeons, and we need to be inclusive. This is just a terrible article. Terrible article.
I will say, for the record, the lead author did issue a public apology, and the editors of the journal retracted the article, and they acknowledged all the errors that were pointed out, that you pointed out, Sal, including the review process issues, the creepiness in terms of obtaining this data, and hopefully this will be a teachable moment for, as they used to say in our, for all of us in medicine. All right. Okay, Sal, do you want to start us off talking about cosmetic surgery of the face and what your plans to talk about it today? And then we can maybe sort of, for contrast, show some celebrities and discuss their plastic surgery as well.
Sure. Well, why don't I do this? Let's just go straight to our case here. I'm going to share my screen. All right. Are you guys able to see this?
Yep.
Okay, great. Okay, so here we have a wonderful older lady. She's in her late 70s and came to see me. She just did not like the appearance of her face. And, stated that she felt that her face was very deflated. There was excess skin, and overall, people always asked her why she looked so tired and uncomfortable. And let's just kind of talk about what you guys see here.
Do you want to go first, Jersey Sam, or should I start?
Please, Texas.
So I think I think, as Dr. Pacella mentioned, this is just sort of shows the effects of gravity over time and the loss of facial volume. And so when you look at this woman, she still looks wonderful for her age, but she shows the general signs of gravity. So what I'll generally point out to people is, if we start with the lower portion of the face, you can see that the jawline has largely been obscured because the midfacial fat has dropped and has created this fullness and jowling. She's got prominent, we call them nasolabial folds or marionette lines around the nose. She's got
sorry.
No worries. She's got generalized descent of the midface away from the lower eyelids. You can see this prominent dark line which sort of demarcates the middle portion of the face from the lower eyelids. When you look at the lateral portion of the eyelids, there's this heavy hooding that goes around with it, which shows that the brow has dropped as well. And so, the big things to sort of tell patients about when you first see them is, one, there's no non-surgical intervention that's going to really give them the full appearance they would like. This requires what we sort of call pan-facial rejuvenation, where we need to think about treating the brows and the eyes and the face and the neck and the chin in this patient, because she's got an underprojected chin, potentially adding volume through the form of fat graft. So a broad sort of expansive approach is needed to this case.
Yes, I second everything that Texas Sam said. I would... And some of what you also discussed is not only facial aging changes, but just aesthetic facial proportions. So I know when we were residents, we had to do aesthetic analyses of patients and split the face into thirds and look at proportions. And you can certainly see, as Sam pointed out, that the chin is significantly underprojected compared to the rest of her face. And so it's not just aging changes, it's actual underlying aesthetic proportions that this patient, disproportion that this patient has. The other thing is in addition to the the gravity changes, she's also lost a significant amount of volume. So my guess is, just like all of us, if you look at any of her pictures from 20 or 30 years ago, she had way more soft tissue volume, which was elevated and significant. And, you know, that's what makes us look youthful. So that involution or loss of volume is also something that you could pretty much tell in this patient as well.
Yeah, those are all very very astute comments here, Jen. So, you know, in San Diego and La Jolla, there's a huge retirement population, and I see a lot of patients who have not had any work done throughout their lifetime, and then, you know, they're still very healthy and still very vibrant, and, you know, at age 70, 80, sometimes they're coming in for facial rejuvenation, and this makes it makes it a bit more challenging than somebody who's in their 60s or 50s. So, and just to reiterate what you guys were saying here, I think, you know, the pan facial approach is very, very important. And many times patients just focus on one specific attribute of their face. So, for example, their eyes. You know, this woman, her major complaint was these lower eyelids. Obviously, we have a big lower eyelid bag here, but we also have this thing right below the eyelid bag called a malar festoon, and that's an anatomic issue right here. There are some ligaments that go directly from the skin all the way to this to the base of the skull base here, and it's a challenge if you don't know what you're looking for here to release these ligaments. And so just simply rejuvenating the eyes is going to help with the central face, but it doesn't help this lateral face. The other issue is that we sort of get into this scenario, the older you are, that if you start tightening up one aspect of the face, it makes the other aspect of the face look very redundant and unnatural. For example here, if we were to suspend her lower face only, I would make an incision along the front of the ear here. I would tighten this area up, but then all of a sudden that creates this redundancy in the brow area. The analogy I like to use is, you know, imagine yourself going to Nordstrom Rack and getting a dress or a suit, and you try the suit on, it's a size too big. You can't just simply take it to the tailor and tighten up the waistline, right? Because if you do that, it's just going to make the top and the bottom look bunched. You have to really recontour the bust, the A-line, the entire construct of that fabric. And that's really the philosophy of facial rejuvenation if we want things to look natural. If you want things to look unnatural, you could just certainly tighten things up willy-nilly or tighten a little bit of skin, but patients will be sorely unhappy.
You know, Sal, I would like to add, I think the issue also can be communication with the patient. So if this patient came in and said, I don't feel like I am myself anymore, I just need some lip filler, and I think that's what will fix my aging issues, then you have to talk a lot with that patient. So sometimes It's like you said, it's about not only understanding what the patient needs, but communicating with the patient about what they perceive their issues to be.
Yeah, and along those lines, you know, as you sort of alluded, this is a woman in her 70s who clearly hasn't been doing fillers or Botox. I'm going to make the assumption that whatever you do to her has to result in a natural aesthetic. There are patient differences, regional differences, sort of based off of the amount of work people have had up to a given point that influence what their expectations for a final result. So to me, a good result in a patient like this would be something that made her look the way she did 10 or 15 years ago, as opposed to something that would make her look different than she ever has before. And I know that sounds silly, but there are people who want to look dramatically different or have had a lifetime of fillers who already look somewhat unnatural when you're starting with,
Right.
And they'll get a very different sort of result.
Right. So, so let's go over our plan here. So obviously, you know, I did discuss whether doing a pan facial rejuvenation, and let's start from the top here. So really, you know, looking at the eyebrows, we want to suspend the eyebrows up a bit higher. So I described something called a direct brow lift, which is done right underneath the skin as opposed to the fascia of the face. And that achieves a nice brow lift. We talked about doing an upper blepharoplasty, which involves removing the skin and adding a little bit of volume with some fat to the upper lid. Her lower eyelids, obviously a tremendous amount of deformity here. So I talked about doing an extended lower lid blepharoplasty or lower lid lift with adding some facial fat in this region. So going back to the facial fat concept, she's really very deflated. So one of my strategies is not only pulling things up to a higher position, but adding some natural restored facial volume. If you look at her face here, it's very elongated, very thin in this area here, very under deflated right here. And we want to create more of an oval aspect to her face, something a little bit more balanced. And that's what we can easily achieve with fat transfer. And then finally, doing a deep SMAS or high SMAS facelift. The SMAS facelift not only takes the skin and suspends it up, but the deeper muscle component of the face gets suspended upwards, and that'll really help with this jowling effect. And then finally, we talked about her chin. Her chin, anatomically, if you looked at her photos when she was 20, we didn't have any photos, but clearly this chin has been this way her entire life. Her chin is very underprojected, and it gives this appearance of having a pointed-looking face all the way down here. There's virtually minimal balance to her lower face here, and we want to restore some of that balance with perhaps a chin implant. One thing I want to point out here is this distance from her nose to her upper lip compared to the distance from her lower lip to her chin. This is obviously a very long distance here. We talked at one point about doing something called a lip lift to shorten this distance so she has a little bit more perky or pouty looking lip. So that is certainly an option in somebody with an elongated lip. This is a very common thing we see in older patients, but she opted against that. So, but everything else, she's good to go. Any comments or how you would address any of these differently, gents?
No, I was just curious to see your final results, and then ask you questions on that.
Sam and I have not seen or discussed this case with Sal before he presents.
All right, so here we are. We did a brow lift, upper and lower blepharoplasty, extended lower blepharoplasty, fat transfer to the cheeks, and full face and neck lift with a chin implant. Let me show you the side view here. And, just looking at the side view here, you can see the distance that this chin adds to her lower lip. And I used an implant that was about 1.8 millimeter projection, and that really helped to balance this position right here. We want to bring this chin forward up that way. So
a few interesting observations. First of all, obviously a great result. Obviously dramatic change. She looks 20 years younger than she did before.
Yep.
A few technical questions. One, so you said you did a high SMAS facelift, but you also added some fat as well. Did you say that to her?
Correct.
How much fat in general do you add to a patient like this? Because she has so much more youthful volume than she did preoperatively.
Yeah. So in this particular patient, I added about 25 cc's in the cheek and zygomatic area directly, and then into the nasolabial folds a bit, and then usually just a cc or two in the lower lids.
25 per side or 25?
Per side, yes.
Okay.
Yeah, so a substantial, volume, I would say.
That looks amazing. And then what kind of incision did you do for your subcutaneous brow lift? Did you go on the hairline? Because I noticed her hairstyle is different now. Was she hiding her incision? How looks like that?
Yeah, so I actually made two separate incisions here. So if you see here, you can see a little bit of the cut right here into the central area of the face. But then the subcutaneous brow lift, in order to get up here, I made a hairline incision right here. So this was not all one particular incision.
And I think what's really awesome about her results was you talked about how you discussed with her potentially doing an upper lip lift. You didn't do it, but it still looks like you did, which is fantastic. And that just shows how big of a difference adding volume and resuspending things to where they should be can really make a youthful appearance. I mean, it looks like you shortened that distance without actually doing it.
And I think a lot of this is really the chin implant. Just look at the side view here. You can see how that chin implant just really extended the chin length nicely and just really magically helps this position of the nose to the upper lip by elongating this area here. It makes her face look a little bit longer, but more oval shaped.
So for people listening, a high SMAS facelift is definitely sort of a more invasive tightening of the SMAS. really powerful results that come along with it, but sometimes more post-operative swelling. How long did she feel like she looked socially unacceptable after surgery?
Yeah, so that's a great question. So, I tell patients if you're just simply talking about a face and not the eyes, socially unacceptable for close to about 3 to 4 weeks afterwards. You can still get some swelling in and around the chin and facial area. When we're adding the lower eyelids, without question, are singularly the most swelling that one can have in facial rejuvenation, without question. So I routinely tell patients your lower eyelids may be a bit swollen for at least 3 months after surgery. That may include some swelling of the white of the eye, some looking like your eyes are tearing, some redness associated with the lower eyelids. So they really have to go to buy into the fact that the lower eyelids are going to be swollen for several months.
Yeah.
What I really like about this result, I mean, it is absolutely fantastic, is, the fact that, I mean, a lot of times when we do rejuvenation, we are restoring, but we're not actually altering facial proportions, or at least skeletally. But in this case, by actually doing the chin implant, you have reduced that mentalis strain. That her upper lip has changed in a very positive way, because she had to basically pull her upper lip way down in order to achieve repose with her lips closed, and then adding that support with that chin implant, like you said, basically allowed her to keep that upper lip length shorter, and basically affected those proportions without doing a lip lift for her. She looks natural without being overdone, and I think a lot of times when you start changing skeletal proportions, you have to watch out for that, and this was a great example of making someone look youthful without changing them dramatically in that regard.
One other issue that I find to be a bit of a challenge is many patients say, Dr. Pacella, I just don't like the consistency of my skin, this leathery looking appearance to my skin. And sitting here in Southern California, San Diego, La Jolla, there's a tremendous amount of sun damage that most people have, even in their 40s or 50s compared to their 80s. And so, I don't necessarily want to do facial resurfacing, meaning changing the consistency of the skin at the time of the facelift, but that is certainly an option. I work with a cosmetic dermatologist that can add a significant amount of laser resurfacing here. But the key here is you got to start with the lower foundation of the face. You got to tighten things up before you start adding laser here. So, for example, in this gal, this is without any laser resurfacing or any other modality, and she still has these pigmentation changes. She still has some fine wrinkling here. But overall, if you just see how much smoother her face and neck is, that just is a bigger bang for your buck when it comes to laser resurfacing after the fact.
Yeah, they go hand in hand, but you're completely right. The foundation has to be addressed first, and the surface stuff is an ongoing and lifetime thing that you need to do around the time of surgery and throughout your life. Otherwise, sun damage will always come back.
Right. On a personal note, I just sometimes will throw a chemical peel in at the same time I'm doing either lower lids or a mid face. They have to recover anyway. They have to be fairly fair complected or have some resurfacing experience, so I know I'm not going to cause hyperpigmentation, but that's a freebie that I'll throw in sometimes.
Yeah, I'll commonly do a resurfacing laser at the same time as well for areas that I haven't undermined or lifted the skin up for our viewers. I'll do that commonly too. So
very nice.
Great.
All right, gents.
Well, do we have time for one more thing, or do you think we should wrap it up, gentlemen? What do you guys think?
Well, we're at about a half hour. I think we could always
hit the celebs later.
Yeah.
That's true. I mean, I don't think it's going to top what we just saw anyway, and so why shame some celebrity plastic surgeon out there for
exactly. No good reason? We've already shamed a vascular surgeon we don't know. There's been enough shaming for the day. Great.
That was amazing.
Yeah.
Do you routinely do panfacial rejuvenations like that? Because that's pretty dramatic. But also, extensive.
Yeah, it is a pretty extensive procedure. Something like that would take me probably a good 6.5 to 7 hours to do. The lower eyelids, particularly when she has so much deformity there, that takes a bit of time to get right. And, it's a symmetry of both sides that's the issue. And, you both trained at great institutions in addition to Michigan, but your fellowship program. So, I think the three of us understand just how intricate the face is, and going into the subsmask position is a little nerve wracking sometimes and takes some talent. So you got to take your time doing a case like this. This is an all day event. So
no one ever said Dr. Pacella is the greatest surgeon. He did my case in 3 hours. They say he's the greatest
Right.
surgeon because he took his time, and that's an amazing result. If she's not ecstatic, then there's no point to be in plastic surgery, because that's as good of a result as you can get.
I also like the fact that you took the time to really go through this with her. You can tell, because you said, listen, we talked about all these different things. And when you make that kind of dramatic change, finding a surgeon who will communicate well and, make that patient feel comfortable going into something like this, that's important.
And one thing I have definitely learned from Pacella, because, we all have our areas of specialty, but Pacella really is considered nationally to be an eyelid specialist. I mean, he is well known for doing that. And it's really true. Patients sometimes don't respect the lower eyelids as much as we as plastic surgeons do. They think, oh, it's just this little thing. It's this little structure on the face. I should recover really quickly from it. But it is a tough thing in our practices. That if you haven't adequately warned people about the swelling they can get after lower eyelid surgery, they can be pretty unhappy. So I like hearing you emphasize that aspect over and over again about how much you need to respect the lower eyelids, because that's something that viewers should listen, and other plastic surgeons watching this should also really stress to their patients.
Right. And this is a gal who's never had any facial or lower eyelid surgery before, and I tell patients like this 3 months of recovery. I also see a fair amount of revision patients on the lower eyelid, people who have substantial deformities of their eyelid, ectropion, or other shortening deformities of the eye. And recovery for those cases, gosh, can take upwards of a year. It's a real challenge, but rewarding nonetheless. I mean, this is some of the most rewarding and fun surgery that we do in plastic surgery.
Yeah. Well, thanks for another illuminating session, gentlemen.
All right.
I've learned, just always have.
Always.
Have a great Sunday, everyone.
All right. Signing off.
Take care, guys.
Take care.